Hello everyone and welcome to Marvelous Concepts. Today we will discuss drug administration routes. This is a crucial topic both in terms of exams and in everyday life. It is very important especially for first semester students. In simple way we can say the way or path by which drug moves and give its pharmacological action. The route of drug administration is simply defined as the method via which a medicine is injected into the body for the purposes of diagnosing, preventing, curing, or treating various diseases and disorders. A drug must get into contact with the tissues of organs and cells of tissues in some way for it to have desired therapeutic effect. And in order for this to happen, the drug must be administered appropriately. The route of our drug administration has direct impact on drug bioavailability, which dictates the pharmacological effect, onset, and durability. Many factors can influence the route of administration that you choose, including convenience, state of the patient, desired onset of action, patient's cooperation, the nature of drug, as some drugs may be effective by one route only, for example insulin, and age of the patient, effect of gastric pH, digestive enzymes, and first pass metabolism. The following characteristics, qualities, and condition influence route selection. Let us go through them in more depth. The physical or chemical properties of drugs, such as whether it is in a solid, liquid, or gaseous state, and what is the solubility of drug in a particular solvent, such as whether it is lipid soluble or water soluble, and what is the significance of these three forms of drug with their solubility parameters. If it is in a solid state, it will enter through the oral route and pass through GIT, where it will disintegrate, then dissolve with the liquid in GIT and show dissolution, after which it will be absorbed and show action. To exhibit action, it will have to go through 2 to 3 phases, whereas there will be no disintegration in liquid state. It will promptly undergo dissolution, and there will be a diffusion in gaseous state. Solid availability is lower than liquid availability, and liquid availability is lower than the gas availability because gas can enter our systemic circulation through the lungs due to its volatile nature. Now let's talk about solubility and pH, which are very important parameters for any drug action or bioavailability, as well as determining which dosage form to use and which route of administration to use. Depending on this solubility and pH, whether it's water soluble or lipid soluble, the route of administration will be determined. If it's water soluble, it will be given orally. If it's lipid soluble, it will be given topically. Another is the site of desired action, which refers to where you want a drug desired effect to occur, whether it is on one specific area or throughout the body. There's nothing but generalized or localized action. For example, if you have an infection in one specific area, you will apply medicine to that area. That is localized action. Whereas if you have infection throughout the body, you will use antibiotics through any other route that provides systemic circulation to distribute the drug throughout the body. That is a generalized action. The rate and extent of drug absorption is referred to as bioavailability, and it is a critical factor in achieving pharmacological effect. Bioavailability is determined by drug's route of administration. When compared to other methods of administration, IV has always had a better bioavailability. Metabolism of drug. In this, the first pass effect is a drug metabolic phenomena in which a medication's concentration or drug concentration is considerably lowered before it enters the systemic circulation, especially when given orally. It's the percentage of drug that lost during the absorption process, and it's usually linked to the liver and the gut wall. When it comes to bypass, there are two ways to bypass first pass metabolism, involving giving the drug by sublingual or buccal routes. The drugs are absorbed by oral mucosa in both these methods. Rapidity of response. We can use tablets through the oral route of administration in case of headache or fever, but we can't use it in cases of severe accidents or emergencies because it will take too long to show action because it has to go through the entire complex process of disintegration, dissolution, and metabolism, which can delay drug action. So, we use IV to achieve earlier drug action. Condition of patient. The patient's state is also significant as the right route of administration is determined based on the condition. For example, if the patient is vomiting, we cannot administer pills orally. And if the patient is unconscious or in coma, IV and IM are preferred. Local and systemic routes are the two types of administration routes. The local route is the most simple method of delivering a medicine to exact location where it is needed. When systemic absorption of a drug is intended, drugs are often supplied through one of the two routes. They are enteral or parenteral. The medicine is absorbed through the gastrointestinal tract via the enteral route, which includes oral, sublingual, and rectal administration. Injection routes, example intravenous route, intramuscular route, subcutaneous route, etc., and inhalational and transdermal routes are all examples of parenteral routes, which do not require drug absorption via the gastrointestinal tract. The following are the main routes of drug administration. Let us go through them in more depth. Oral route. This is the most common method of drug administration. It is the first choice for drug administration when practicable, as it is both convenient and cost effective. Orally given drugs are swallowed after being inserted in the mouth. Most orally administered medications are rapidly absorbed in the bloodstream from the gastrointestinal system within the limits of drug physicochemical properties. Antacids for heartburn and zetamides for cholesterol absorption reduction are examples of medications that are taken orally for their local effect within the gut. Oral agents must be able to resist the stomach acidic environment and penetrate the intestinal lining before reaching the bloodstream. Tablets, capsules, suspensions, emulsions, and solutions are most common oral dosage forms. Sublingual or buccal route. The medicine is put under the tongue, that is sublingual route, or between the gums and the inner lining of the cheeks in this mode of administration, that is buccal route. The medicine is allowed to dissolve in both circumstances, avoiding ingestion as much as possible. The drug is rapidly absorbed into circulation through the mucosa, bypassing the portal circulation, and as a result, the liver's first pass metabolism. When the medication is destroyed or partially inactivated in stomach if taken and the faster action is necessary, the sublingual and buccal routes are useful. Bitter medications, on the other hand, are not suitable for these routes. Nitroglycerin, nothing but glyceryl trinitrate, and buprenorphine and disaminooxytocin are examples of medicines that are administered by sublingual and buccal routes. Rectal route. Rectal administration of medication is sometimes required. Many soluble medications can be absorbed in bloodstream by rectal mucosa. Rectal medicines might be in the form of suppository or liquid be used as retention enema. Unlike the oral route, the rectum can be used to give irritating or unpleasant medications. When a patient has a chronic vomiting or is unable to swallow, the rectal route may be preferable. In addition to the local administration, this method can be applied for systemic drug administration. Topical route. Drugs are applied topically to the skin or mucous membrane of the eye, ear, nose, mouth, vagina, etc., mainly for local action. This approach allows for high local concentration of drug to be achieved without compromising the oral circulation. Drug absorbed into bloodstream after local administration, on the other hand, may have systemic effects. Creams, ointments, liniments, and drops are the most common form of drugs for topical use. Transdermal route. Because the medication is contained in a patch that is absorbed via the skin, the transdermal method is usually referred to as the patch. Drugs that are delivered in this way must have high lipophilicity. This mode of absorption is slow, yet it is favorable to providing long-lasting effects. Some transdermal patches are use special slow-release matrices to keep medication concentration consistent, similar to those of continual IV infusion. Transdermal patches help reduce gastrointestinal absorption issues that are common in people who take oral drugs. Fentanyl patches for severe pain management, nitroglycerin transdermal patches for preventing episodes of angina in persons with coronary artery diseases, and nicotine patches for smoking cessation and other drugs are administered by this manner. Inhalational or pulmonary route. Inhalation is a frequent method of drug delivery for both local and systemic effects, using both powdered aerosols, for example, salmeterol xenophate, and pressurized metered dose aerosols carrying the medicine in liquefied inert propellant. This delivery mechanism is particularly beneficial for direct treatment of asthmatic disorder. Example, salbutamol sulfate inhaler. Drugs can be inhaled as gases, example nitrous oxide, and then diffused over the alveolar membrane into the bloodstream. This is how volatile anesthetics like ether, halothane, and methoxyfluorine are administered. When a medicine is administered as a gaseous or aerosol mist or ultra-fine solid particles, the lungs provide a good surface for absorption. As a result, action takes place quickly. Another benefit is that plasma concentration may be changed quickly. Injection routes. This is the second most popular method of drug delivery. They mostly entail injecting the medicines as a solution or suspension into the body using a syringe and needle at various sites and depths. As a result, there is a risk of infection, discomfort, and local irritation during administration. Injection routes of drug administration are commonly used in following situations. If rapid effect is urgently needed, as in emergency situations, or if the patient is too ill or unconscious for oral route to be employed. If the drug is orally ineffective due to its being destroyed or not absorbed from the gut, or if an injection is only way for the drug to reach its required site of action, or if there is a need to maintain a steady blood level of a drug. The surrounding tissue or site must be as clean as possible, and all tools used must be clean and sterile according to the most significant factors or standards in all injection routes. Subcutaneous, intramuscular, and intravenous injections are the most prevalent. Intra-arterial, intrathecal, intraperitoneal, intravitreal, and other routes are used less frequently. Subcutaneous means administration beneath the skin, or hypodermic, synonymous with the term subdermal or hypodermal, and intramuscular means administration within a muscle. Intradermal is administration within the dermis. Intravenous means administration within or into a vein or veins. Intra-arterial is administration within an artery or arteries. Intrathecal means administration within the cerebrospinal fluid at any level of the cerebrospinal axis, including the injection into cerebral ventricles. Whereas intraperitoneal means administration within the peritoneal cavity, and intravitreal means administration within the vitreous body of the eye.